So welcome everybody. This is the October both contractor update and field manager update that we're doing together. We've got an agenda out today where we're going to be talking a little bit about some service rag sheets that the LPC is doing. We're going to be talking about the new contract, a contraception pilot that's coming up. We're going to highlight some materials as well as talk to you where we're up to with some of the pharmacy quality elements of the PCN leads and the flu provision so far. First things first, Sarah's our engagement officer is with us today, and she's got an update about the GPC PCS and some of the experiences that you found so far. So Sarah, can I hand across to you?
Thanks, Adam. Yeah, I'm just going to share my screen with you all.
Perfect.
So I've just got a very quick presentation just to update you on where we are and what issues we seem to be facing across the area. So first of all, I just wanted to show you our progress that we've made across Cheshire and Wirral with the referral status. Month on month, we are growing in referrals, but also month on month, we are growing with non-processed referrals. And we really need to capture this because this is lost revenue. Not only do we need to capture this information, but also these dropped referrals. As you can see, there's a large quantity of dropped referrals. Now, I will go into these dropped referrals a little bit in a moment, but a lot of these referrals can be actually actioned by pharmacy, and we're missing out on that revenue coming into our contractors.
So do you want to just hit F5 and it should put it in full screen mode, so for people sharing?
Okay,
there
sorry.
You can click through it now.
Okay, so what are these examples of these referrals that are coming through to the pharmacy? So first and foremost is the pharmacist is not accredited and is not able to diagnose ear infections and cannot prescribe antibiotics. The service isn't there just to prescribe antibiotics. The service is there as a service to patients to be seen at the pharmacy and then an on-route referral to go to the practice if required. We're missing out on a lot of these, so we need to make sure that all our staff are educated on that. The patient is over 65 and is not covered by the minor ailment scheme. As part of the GPC PCS referral, you don't need to be able to provide a minor ailment scheme for that on referral to go through. So we just need to make sure that we are bringing this to our staff's attention. Patient brought some Canesten over the counter. We could still claim for that referral because we've had that consultation and then we've sold them an over-the-counter medicine. Patient needs a prescription off a doctor for medication. We've obviously assessed that patient, had a consultation, and then decided that the patient needs an onward referral. If we would have done that in the pharmacy, we would have been able to claim for that service. So these referrals are being dropped off when there's no need for them to be dropped off. So we need to make sure that we're working with our contractors to ensure that we can capture those referrals. And that's partly what I'm doing at the moment. So I've put together this presentation just to make you guys aware of what's happening within the locality and what you could possibly be putting through to your teams to actually make sure they're capturing this data and we're not losing that revenue. So what are the ramifications of this? So all of these referrals could have been claimed for as the patient had received a consultation, advice or an onward referral. So over 50% of these rejected referrals or dropped referrals could have been processed by the pharmacy. If a patient requires an onward referral from the pharmacy, it's the pharmacy's responsibility to make that appointment for the patient. So we need to be making sure that our pharmacies staff and our pharmacists are aware that they need to make that appointment for that patient as part of the service. So that's why a lot of these referrals are being rejected. We need to try and capture that to stop that from happening, because obviously if we can get that revenue and get paid for what we've already provided, we're already doing the service, we're just not claiming for it. We've also had issues where staff haven't been able to access NHS mail when their regular pharmacist is off and they've got a locum in. We need to make sure that all staff have access to shared mail accounts. So if you do have any issues with any staff needing access to that, if you could let me know, I will assist them in making sure that they've got access to that shared mail account via their own login details. We also have been seeing rejection referrals because pharmacists haven't got access to a smart card. If we've got any newly qualified pharmacists that are having any issues getting smart cards, or any existing staff that need to be allocated with smart cards, if you can just pass them my details, I'll be happy to assist them to get that up and running as soon as possible, and so we can get that issue resolved so these referrals can be actioned for patients. We've also had a number of rejected referrals because there's a locum in the pharmacy and they're not accredited to provide that service. Within Cheshire and Wirral, we've got loads of materials that we've designed for locums working in our locality, covering all the services that we provide within each locality that we offer. We have these available, so if you have any pharmacy locums or any agencies that you use and you think that you could share that information with myself, let me know and I'll be happy to share those packs to ensure those pharmacists have got those details of how they become accredited to provide that service, so we've got full coverage over the core opening hours of the pharmacy. As I said, over 40% of these rejected referrals could have been processed, so we're missing out on that revenue coming into our contractors for the work that they've already carried out, and that's just what I'm trying to share with you, is the work that I'm doing to try and implement that, to work with the contractors to improve their knowledge of the service. But if you can obviously support them as well by passing any information on to them that you think could be relevant, or any training that they could attend, that would be, you know, something that I'm going to look into with them. So if you've got any pharmacies that you think would benefit from a call from myself going into the pharmacy to actually assist them with the service, I'm happy to do so. I just need obviously an invitation, so please let me know. Thank you.
Brilliant.
I'm sharing now.
Thank you for that, Sarah. I think it's really, I suppose, devastating that people are doing the service, but just because they're processing it wrongly, they're not then getting paid for it. And I think that's absolutely where we need to be, is supporting these contractors to actually get paid for what they should be getting paid for, having delivered it successfully. Anyone who's not sure, there's some really good materials on our website. I think if you go under services, under your locality and national services, there's a link there that takes you directly through to the CPCS materials, including the GP-CPCS checklist, which has got many of the local procedures on place. So that'd be really helpful. The other thing I did want to touch on is around emails and phone, particularly, I mean, you mentioned it there in terms of the hot handover to the practices. Many practices will have, they call them backdoor numbers or clinical response numbers, either listed on Service Finder if you're a Cheshire or a Warrington pharmacy looking for a surgery, or if you're a Wirral surgery, you've had that latest version into your inboxes. I think the last version happened near the start of the pandemic. We're currently asking for a refresh, so as soon as that comes up, we'll distribute it out. But if you're ever in doubt, please contact us through the support email address, and we'll make sure your pharmacies have the right backdoor phone numbers that they need to be able to hot hand over to the surgeries. The other thing I wanted to touch on today was around we're currently about to launch some what they call service rag sheets. So what we've been looking at is a number of our services across the patch. We've been rating various elements of the service, red, amber or green, which includes how easy they are to operate, how profitable they are, how they can fit in with the daily pharmacy routine, and the sort of volume, whether it's going to be relevant to do them. And that should really give both contractors a guide on whether what they should think about when they consider offering those services. But it's also around how we respond to our commissioners and how we go back to commissioners to negotiate. So as they come out, please stay close to those. If there's any you disagree with or you think we've rated wrong, let us know, and we can have a look at that, because obviously your feedback will help the LPC consider that differently. But they all will have gone through the committee or the subgroup within the LPC committee on services to have a look through. Next thing I did want to talk around today was around the new contract. Obviously, we've seen a number of things come out in year 3, and over the next couple of weeks, we'll see the LPC support ramp up for it. So the things we're currently looking at is the new elements to the new medicine services. So the 18 conditions that can now be included. also around the catch-up provision. So anyone who's been prescribed any of even the new conditions throughout the pandemic period is eligible to go back to receive an NMS. So there's some good opportunity there to give the patients best care, as well as to earn an income for your pharmacy. And then the two new services, the smoking cessation referral scheme, which we haven't seen the service spec for at the time of filming, but also the hypertension case finding service, which we've now had the draft service spec out for. There's quite a lot of interest in that. So certainly a lot of the GP meetings that we've been attending, they've been very keen to know how it works. So I'd expect that to be quite a collaborative approach locally to getting patients onto this service in terms of the people who are needing an ABPM and just haven't had one yet for whatever reason. And actually there's some good opportunities to engage with these surgeries locally on that. We will be running some LPC training, probably in about 2 weeks' time, it looks like, and we'll get the dates out via our newsletter and our normal routes. And we're going to pitch that across, like the last few new contract events. It's going to be right across Cheshire and Merseyside to do it as a fairly large-scale webinar. So that will be coming. Please watch out for that. Another thing to talk to you about was for Wirral contractors particularly, is there's a contraception pilot that you may well have seen some snippets of in Pharmacist magazine and the Chemist and Druggist. Not talking about our area, but it's a national pilot. We have got 3 PCNs that are due to go live on that. So for us, that is Healthier West Wirral, Healthier South Wirral, and Birkenhead. We're just awaiting on clarity on whether it's all of Birkenhead or just Brighter or Arno or how they're defining it. But we're expecting to see some expressions of interest coming out through NHS England shortly, and we'll be reviewing the service spec, which has come out in draft form through the LPC, and we'll be in touch about that in due course. The other thing I wanted to talk about, sort of while we're on PCNs, is obviously the pharmacy quality scheme is running at the moment. Part of that is some activity for the PCN leads to be doing. We still do have 3 PCNs which don't have a lead appointed, and we've written out to all the pharmacies through their NHS mail. So if you're a pharmacy that resides in Chester South, in East Warrington, or in Winsford, please can you have a look at your NHS mail and your shared inbox and consider if you'd want to stand as a PCN lead. Unfortunately, that element of the pharmacy quality scheme, the whole domain around that flu provision and increasing the uptake in the over 65s, that domain cannot be scored if you don't have a lead carrying it out. So if we aren't able to get one nominated, pharmacies in those PCNs won't unfortunately be able to make the claim for that domain. So please consider it and come back. Alison's written out to you all. And then the last thing, as I'm sure we'll all be aware of, is just to very briefly touch on the flu provision. Pharmacies are doing a great job with flu this year. I think that goes without saying. The numbers are quite spectacular though. We've all at the end of last week, we'd done a third of what we'd done in the entire year last year. That number is now creeping up to just under half of what we've done, and we're only at the start of October. So pharmacies are going great guns, so well done on the flu provision. There has been a ton of advice come out, so please look at that through the LPC. We've particularly focused on the advice around the types of vaccines to use and when they can all be, because I think there's been significant confusion of that from the Public Health England messaging. It is quite clear when you look at it, but it wasn't clear at the point of ordering. So please just review what vaccines you're using and to make sure you're compliant with that. And if there's any questions or queries, again, please get in touch with us. That's probably everything I wanted to say at this point. Is there any either questions or any other builds or anything I've missed on that element you'd like to ask me about? No? Fab. Well, I will stop the recording now, and obviously if there are any questions, please come back to us. But thank you for watching.